I'm Razia Wong, psychiatrist and adjunct clinical associate professor at Stanford University. Today, I'll be your guide through this short video on the impact of extreme heat on mental health. Our learning objectives today include describing the link between climate change and extreme heat, outlining the impact of extreme heat on mental health, identifying our patient populations at highest risk, and outlining some clinical opportunities to address these issues. As we know, the term climate change describes the gradual warming of the planet due to the trapping of heat by greenhouse gases in the atmosphere that accumulate due to human activities such as burning fossil fuels. You might wonder what this gradual process of climate change has to do with extreme heat, which is a short-term weather event. Well, studies show that climate change increases the frequency and intensity of extreme weather events such as storms, flooding, and extreme heat. In this graphic from the National Oceanic and Atmospheric Administration, we can see in the top left graph that the average number of heat waves per year in the US has actually tripled since the 1960s. And extreme heat can have direct impacts on the body and the brain. Exposure to extreme heat impacts physical health, especially cardiac and renal function, negatively impacts our emotional states, cognitive function, and disturbs our sleep. And all of this can lead to worse mental health outcomes. Studies show that exposure to extreme heat can raise levels of stress and anxiety. It also increases the incidence of suicide and overall mental health-related morbidity and mortality, driving up our rates of emergency visits and hospitalizations. Extreme heat has also been linked to increased rates of aggression and violence, including intimate partner violence. But it's important to note that even within a similar geographic area, extreme heat does not affect all people equally. Certain populations, including the elderly, infants and children, pregnant people, those with chronic medical conditions, people who work outdoors, those with lower socioeconomic status, those living in urban heat islands, and those who are incarcerated are at greatest risk for heat-related illness. Some communities of color or low socioeconomic status reside in urban heat islands and have higher exposure to extreme heat due to the increased use of building materials that absorb heat and decreased green spaces. These communities may then experience more adverse health and mental health outcomes. Some psychiatric patient populations may also be at higher risk. Studies show that patients with substance use disorders experience higher morbidity and mortality during extreme heat and may seek more emergency services during heat waves. Our patients with serious mental illness, particularly those who suffer from schizophrenia, may also have a much higher risk of death during a heat wave. This increased risk may be due to exacerbation of medication side effects, cognitive impacts of heat, increased exposure due to homelessness, and social isolation. The good news is that as a clinician, there's actually a lot you can do to help protect your patients from the impact of extreme heat. Most important is the anticipatory guidance you can give your patients ahead of hot summer months, including giving advice on how to stay cool and considering modifications to their treatment plans to minimize their risk. You can also consider referring your patients to community resources, such as cooling centers. These are publicly available buildings that have air conditioning and where your patient may have some relief from the heat. Just a few hours in a cool environment may significantly decrease health and mental health impacts. Thank you for taking the time to view this video, and I hope this gives you some initial steps to take to help address the impact of climate change and extreme heat on our patients.